Dr. Moore with Sienna Dermatology, and today we have Dr. Dang here with us for his skin pen procedure.
Right, I'm so excited. I heard a lot of great things about skin pen. Dr. Moore, do you want to tell me some of the benefits of this procedure?
Sure. So skin pen was actually FDA approved for acne. However, when we're creating microchannels in the skin, we also see a lot of skin tightening, a lot of wrinkle reduction when we do it. So a lot of patients have sought after it for an anti-aging process as well.
Wow. So, in my teens, I grew up with a lot of acne. I had a lot of acne scarring. Is this something for me?
Absolutely. So it's actually been approved for ages 22 and older for acne scars specifically. It's the only one on the market that's been FDA approved for that. So yeah, it does a fantastic job. Usually it takes about 5 to 6 sessions for us to see a big change in your skin.
Right.
What you'll expect is a lot of reduction in the pitting. A lot of those red marks that are left behind will start to fade and go away. And you'll get a lot of skin tightening with it.
Wow. And then after the initial 5 to 6 sessions, how often do you have to come back to maintain?
Usually we recommend 3 to 4 times a year. So generally quarterly patients will come back and kind of get their update, if you will.
Okay. Does it hurt?
Actually, the skin pen, those microneedles are kind of vibrating very fast. So most patients just feel that vibration. They don't actually feel the little microchannels being created.
Oh, that's awesome. Who, other than people like me with scarring, who else is a good candidate for this?
So as I mentioned, we do like to use it as an anti-aging. So truly any age group, definitely patients with a lot of wrinkles, pigmentation, a lot of skin laxity can all get benefits from it as well.
And the next closest thing is?
The next closest thing would be a laser treatment. And so the difference between it and why you would choose this over a laser treatment, especially for your skin type, with lasers, you're introducing a heat source as well. That heat production can actually cause dyspigmentation afterwards, so either light spots or dark spots to happen. With the skin pen, we're taking away that heating element, so we can use it on any skin type, really from skin type 1, which is fair skin like myself, to skin type 5 or 6, which is much darker.
Wow.
Yeah, so it's really great, and there's almost no downtime with it. We'll see afterwards that you look a little bit red, you look a little bit, I would say, sunburned the day of. The following day you look a little bit more windburned, it's a little bit more pink. And then usually by day 3 or 4 you look completely normal. Nobody knows that you did anything. So most patients do it on Thursday, Friday, over the weekend, something like that.
So just very minimal downtime we're talking here, right?
Absolutely.
With no pain, post-op discomfort, really?
Not really, no. We give you a nice little topical medicine to put on the whole day afterwards, and then the next day, females especially are able to wear makeup next day.
That's awesome. Dr. Moore, I have a really bad habit. I stay up late, studying back in the day, and now that habit is carried with me. I'm a night owl, so I have these huge dark bags that I've tried everything. I've tried creams, gels, you name it, facial masks. Nothing has worked. Will this procedure help me out with these dark circles and bags I have?
Absolutely, yes. So we can get that skin pen up around our orbit as long as we have bone behind it, and we can kind of pull the skin down a little bit and really treat under eye circles very nicely.
Wow.
It helps to tighten that skin, it helps to thicken that skin again, which really helps with the dark circles.
So what causes dark circles under the eyes?
Usually it's a thinning of our skin over time, and then you start to be able to see our blood vessels show through.
Oh, I see.
A lot of patients with allergies, you see it a lot more, and because their blood vessels are kind of dilated from, just all their allergic rhinitis going on. So that's why it works great for those patients.
Wow, so I should see a reduction in the darkness?
Absolutely.
How does that work?
It's just really from putting those microchannels in. It forces your own body to bring in collagen to that area and kind of thicken that skin up again.
Wow.
It remodels your blood vessels underneath the skin, and so again, you're not having as many as close to the top of the skin.
That's awesome.
So it really helps with the circles.
So basically my body's doing the work, but the skin pen's making my body jumpstart this process.
Absolutely.
All natural.
Yeah.
So Dr. Moore, I'm a huge scaredy cat. I give injections all day long, but I don't know about taking them.
Yes.
Walk me through the process.
So usually you'll show up about 20 minutes early. Our esthetician will put topical numbing medicine on, so no injectable numbing medicine. We have a really good topical that pretty much works in 20-30 minutes. And so usually when we wipe it down, you really hardly feel that. Plus the skin pen device itself just vibrates really quickly. It's not painful.
Awesome. So there's so many benefits of skin pen as a standalone treatment for myself with my scarring, my bags. Dr. Moore, is there any other procedure that can be added on to enhance those procedures?
So a lot of times we will speak with our Botox patients regarding this because Botox disport our toxins and they really try to smooth out those areas. But sometimes if we start a little bit later in life, they're kind of etched in. So even if we paralyze those muscles, it improves the look of it, but it doesn't erase them. So this is a way to enhance that procedure, and you can do it 2 weeks afterwards, and it really starts to again build in that collagen, smooth out those wrinkles while we're preventing them from getting worse with our toxins.
That's amazing. So what if the patient already had Botox treatment done? Can they still come in for skin pen and it'll help the results?
Absolutely, yeah, absolutely.
Wow.
And we would usually recommend waiting a few weeks afterwards, get your maximum results from your Botox first, and then we can kind of add in that skin pen.
So I'm here mainly for my face, but are there other areas of the body that can benefit from skin pen?
Yes, actually, we can use the skin pen down onto the neck. We oftentimes will use it on the hands to kind of help with that as well. And then for females, stretch marks are a big trouble area for us, especially after our wonderful children. So we can use that skin pen to help reduce the look of stretch marks specifically. So yeah, lots of different places.